We are very fortunate to have two eminent cardiologists of India with us. That's Dr. Samir Dani and Dr. Anish Chandarana. So let me give you a brief introduction about them. Dr. Samir Dani is the CEO of Apollo Cardiovascular Health and Fitness Institute at Ahmedabad. He is Director of Department of Cardiology, Apollo Hospital, Bhat, Gandhinagar. He is a brilliant academic career, and he is honored with a Dr. B.C. Roy Award in 2018. He cardiologist to His Excellence Governor of Gujarat. The second expert is Dr. Anish Chandarana. He is attached to Marengo CIMS Hospital in Ahmedabad. Again, having a brilliant academic career with gold medal at every stage of life. His keen research interest and a strong contributor to many international research when the new molecules are coming. He has contributed a lot in making the proper dosage and the trials. Though he is trained as interventional cardiologist, he has a lot of interest in prevention. And he has done many workshops to motivate people for the healthy lifestyle and happiness. So with that, we move on to the discussion. Before I hand over to Dr. Mahadev Desai, let me narrate a standard disclaimer. The information which we will be providing in this webinar is mainly for the information. Don't take it as a consultation. Your primary physician or your doctor is the most important part of the team, and please take their opinion in deciding the line of treatment. OrthoTV or the experts are not responsible for any complications arising out of this implementation of this information. So with that, now I hand over to Dr. Mahadev Desai to give us idea about why this webinar and what is the importance of this topic. Over to you, sir.
Thank you, Dr. Dhiren. Good evening to all the viewers and our experts. And today's topic, what should I do to prevent coronary disease? I don't think there can be a better time than this to discuss, because we hear so much about the coronary disease, especially in the young, especially after the COVID pandemic. And also there cannot be better experts than two of us, Dr. Anish Chandarana and Dr. Samir Dani. There is so much of information, be it in the electronic media, print media, or WhatsApp universities, that we are literally bombarded with all the informations and do's and don'ts, and tons of garbage is being there in our mobile set as well as in our mindsets. So it is the time that we demystify, distill knowledge from the experts who are, I can vouch for both of them because I have seen them closely for over 30 years, that they are not only in their field of cardiology, they are competent, but their integrity, their knowledge about the overall all fields of medicine, and their command over the subject is par excellent. So I wouldn't waste again more time to deprive you from the experts of these two. And we know that we have been told all the time that we are what we eat. So maybe we start with our topic discussion with Dr. Samir Dani about the questions which is very much prevalent, I'm sure, everywhere, but more so in Gujarat, about the diet, and that too when Navratri and Dasera and they are all approaching, we are all salivating for the fafda and jalebi and all that, whether what kind of diet we should be eating, which oil we should be using, and something about the trans fats and the smoke points. Dr. Samir Dani, please.
Samir, you are mute.
Good evening, everyone, and thank you very much, Dr. Dhiren Ganjwala and Dr. Mahadev, for inviting me over here. I'm sure with Dr. Anish, we are going to enjoy it as much as you will. Because talking about things, even when you are answering questions or even when you are speaking out of your own experience, it helps you in organizing your thoughts. It helps you in formulating your opinion more clearly about things which you may have had impressions. You may analyze them better when you are answering the questions and when you are asking questions. So overall, it is a learning experience for everyone. Which food, which oil is such a question which is everywhere. It is everywhere in everybody's mind. And that is the first question we are asked when we are talking to a patient of myocardial infarction. Once he is fine and once he is leaving the hospital, this is invariably asked. And the one question which is asked is, what is to be avoided? So I have, we have all developed a very different pattern of answering that. And one of the answer is that, which I use frequently, that it is very important to know which food not to eat, but it is equally important to know which food to eat. And probably it is equally important, if not more, is how much to eat. Because it is not only the food which you avoid, which the knowledge about food which you eat and how much to eat, all three are very important. And I think Mahadev wants me to speak about oil first. So let me start with in general, some general principles, and then Anish can elaborate more on that. Some general principles are that the overall vegetable and fruit intake is very important. So most of us, even vegetarians, do not eat enough vegetables and enough fruits. So vegetable, fruit, and nuts, these three are very important aspects of vegetarian diet, which are equally important in non-vegetarian diet and which we are often not consuming enough. Typically, there are supposedly 5 servings of vegetables and fruits which we should consume daily. But leave alone 5, in India, though 70% people are vegetarian in Gujarat, we don't have even more than 2 servings. Maybe fruits, we don't have even 1 serving, many households. So these are important things. Eating grains and eating legumes or lentils is our staple way of preparing vegetarian diet. And sometimes, and of course, we add dairy to it, but many times we forget about vegetables. So many of my patients tell me that I eat only bhakri and doodh and khichdi and curry in the night, and it's very healthy. It's not necessarily very healthy. So, one, vegetables, fruits, and nuts. Second thing, oil which we use. Which oil to be used? Again, a very frequent question. Any oil you use is okay as long as you use it in a very small quantities. Remember that the oil with which you are familiar, the oil which you like the taste of, that oil is important. It is not necessary that olive oil has been shown to be beneficial in some populations, in some geographical areas, is necessarily beneficial to us. The way we cook is very different from the way they cook. And there are certain oils which have a very low smoking point, and olive oil, in fact, or flaxseed oil, they have this problem. They have low smoking point and they are not good for frying. When you fry with olive oil, it probably becomes worse than groundnut oil. So whichever oil you want to use, don't deep fry, do not use them in large quantities, or your overall use of oil should be very limited. Ideally, they say maybe 2 tablespoonfuls per person in the household or even less, which is practical. And whatever you do not try not to reuse that oil once you have fried with.
Right, that's very true. Dr. Anish, do you want to add?
Yeah, I mean, just to start, good evening, everyone. And I must appreciate OrthoTV, Dr. Dhiren bhai, Dr. Mahadev bhai, who has been my teacher, and one of my senior colleagues, and again my teacher, Dr. Samir Dani. Would be surely a pleasant time for me also to learn so many things. And as he rightly said, it's not only just organizing my thoughts and putting them more clearly to the audience and people, but also when I talk and be part of such podiums and auditoriums, that's where my commitment to my knowledge, to put it into my own life, to put into practice, that keeps on enhancing. So taking the story ahead, as Dr. Samir Dani rightly said, as far as food is concerned, I personally believe on 3-4 important fundamentals. Number one, some nutritionist has very well said, eat what is local, seasonal, and traditional. That is so important, so much important, because something which is locally grown is generally a product which has been quite well going with the DNA, with the lifestyle of the people staying there. Something which is locally and seasonally grown and eaten is something which is not preserved for a long time with a lot of toxic chemicals. And something which has been traditionally eaten is something with which our ancestors have made their life happy, pleasant, and they have lived well. So we should be imbibing those concepts. Very important point in today's world, most of the times, if you go to media, if you go to many nutritionists, they have a very myopic view to look at different food components. That is a positivity of allopathic science, that we have a habit of analyzing everything to the minutest extent. And that's why with a myopic camera, we look at protein, we look at carbs, we look at fat. But very important point is, to make a food healthy and to touch our life positively, it has to be a time-tested combinations of various foods and from diverse sources. So far as we eat local, traditional, seasonal, from diverse source and time-tested combinations, I'm very sure we are going to help ourselves. Coming to the second point about oil, maybe 3-4 points, as Dr. Dani has said, in nutshell. Number one, for oil, it's very, very important that what quantity of oil I should be eating on a daily basis. And the safe quantity from cardiovascular viewpoint and from cholesterol viewpoint is 20 grams per day. That comes to roughly 2.5 spoons a daily base. Many of us viewers are in Gujarat state. Many of viewers are in. So 20 gram per day means 600 gram per month for per person, means 7.2 kg per person per year. So a general dibba of tin of oil which is available in market, which is 14.5 kg, that one dibba should be sufficient for a couple for 1 year. Because unless we start using in proper amount, so that what I tell my patients is, if you are 4 people in your family, 600 into 4, that is 2.5 kilogram of oil roughly you should be using in family in a month. So you open a can of 5 kg this month and it has to last for 2 months. That's how they have to slowly try understanding the quantity. Second very important point is, keep changing the oil. As Dr. Dani has said, something which pleases you, something which you are habituated to, pick up those 2, 3, 4 oils, maybe groundnut oil, maybe corn oil, maybe sunflower oil, maybe til oil, sesame oil. You pick them up and keep using them interchangeably as per your requirement. Third point, he rightly said, something which you fry, please do not reuse that oil, because that oil contains a lot of trans fatty acids and they are dangerous. Not only they increase your bad cholesterol, but they have a tendency to produce a lot of inflammation in the coronary arteries, and which is a very important point leading to heart attack in young age. So with this, I think 3-4 important points. Oil makes a big story of life, but one has to understand the quantity and different types of oil to be used.
Thank you, Dr. Samir and Dr. Anish. And I will only add, as Dr. Samir has rightly said, that olive oil may be considered as the best, but as long as it is not used for frying. For dressing, it may be good, but not necessarily for the frying. So that is worth keeping in mind. Now, second important point that our patients keep on asking is about how much coffee or tea or black tea or the green tea we should be consuming. And the recent controversy about the who hype about the A2 milk. So something about the tea and coffee and milk. Dr. Samir. You are mute.
Pardon me, I have this habit of muting myself. Okay, so recently, very interesting studies have been presented regarding coffee and alcohol, especially. Coffee, nowadays, we believe that number of cups are very important. And probably that is true for each and every food type. When you talk about coffee, general acceptance is that more than 4 cups of coffee become harmful. So if you are staying less than 4 cups of coffee, then you are okay. And this 4 cups means 1 cup is generally 70 to 100 milligram of caffeine. So daily intake of 300 milligram of caffeine is considered to be, once you cross that limit, it becomes more and more harmful. By and large, green tea is considered very healthy, and you have lots of studies, but unfortunately, we don't have many studies talking about the green tea quantity. I'm sure that, again, when you talk about quantity, even when you consume large amount of green tea, it will have some harmful effects on health. As is true with most of the things, ati sarvatra varjayat, that holds true for almost everything in life. So I think what green tea, black coffee, whatever you love, even now we have green coffee as well. So whatever you love, all these drinks have certain health benefits when they are consumed in moderate quantities. Coffee has lots of health benefits. It has a lot of good effects on intestines. It has a lot of good effects on our gut health also. Caffeine does well when it is consumed in mild to moderate quantity. It stimulates the brain. But at the same time, when you consume it in larger quantities, it becomes a problem. Talking about the milk, again, very fascinating question, because dairy products have been in and out of favor for such a long time, and the milk, whether to drink milk or not, has been a subject of such great debate. And then now, which milk to drink, and A2 cow's milk, these we are not still, I am sure that the final word has not been said. By and large, I would say this much, that there are many studies which have shown that dairy products are harmful to heart health. But again, the quantity of dairy product consumption is very important. And which type of dairy products you are consuming, that is also very important. For vegetarians, I would tell you one thing, especially that we nowadays, so many times we quantify the coronary risk by getting the CT coronary calcium score done. And many patients ask me, how does this calcium get deposited in the coronary arteries? Maybe I am drinking too much of milk. Maybe I am having too much of dairy products. Maybe I am having these calcium supplements. They are getting deposited to in my arteries. The answer is yes and no, and it is very complex. It is not the calcium which we consume that gets deposited in our coronaries. That calcium is very useful for our bones, and especially when we are growing, especially when we are old, this calcium is very useful. It is the calcium metabolism that, when it gets impaired, this calcium, instead of getting deposited in our bone, it gets deposited in our vessels. And one of the important components for this calcium metabolism is vitamin K2. And this vitamin K2, where do you get vitamin K2? Dairy products for vegetarians. So when you look at it this way, then the dairy products should be very useful. On the contrary, for not getting the calcium deposited in your vessels. And nowadays we are giving vitamin K2 supplements to many of our patients. So I am sure that which milk to drink, what about A2? I am very sure that the last word is not said. Again, I would say that dairy products are reasonably safe if they are consumed in moderate quantities. I would say that the more processed the dairy product is, more harmful it becomes. And drinking pasteurized milk is in moderate quantities, up to 400 to 500 ml per day, is quite okay. Whichever
Dr.
milk it may be.
Yeah. Dr. Anish, do you want to add?
Yeah, yes. I mean, what Dr. Dani said, I think to everything is right. Maybe 3-4 points just to add on and put something extra. Generally, as he rightly said, a coffee has 80 to 120 milligram of caffeine per cup. Black tea has little less, from 50 to 80 milligram caffeine. Even tea has caffeine, and green tea has still little less, 30 to 50 milligram of caffeine per cup. So you can keep consuming all these drinks depending upon the limit of 3 to 400 milligram of caffeine. One thing which tea additionally had is they have got more antioxidants and flavonoids. So theoretically, green tea is supposed to be little more beneficial as far as antioxidant and anti-inflammatory effect is concerned. But I rightly agree that depending upon your choice, one can go ahead. Coming to point of milk, see where the question about milk is bad for atherosclerosis and bad for heart start is almost no other animals in this world have atherosclerosis to the tune which we humans have. And so some people before many years started charting out what are the differences between humans and animals as far as their overall behavior is concerned. And one of them is it's only humans who keep drinking milk after the infancy. If you go to other animal kingdom, all of them just have milk till the God gives the milk to the mother, but we are the people who take milk even after the infancy. So there has to be something wrong with the milk. And as far as science is concerned, the biggest wrong which science has found with the milk is saturated fat. So if you can get rid of fat from the milk, if you can reduce that cream or butter or ghee out of that milk, then 4 to 500 ml of milk is pretty good for calcium, for vitamins, and for K2 vitamins, as Dr. Dani rightly said. Coming to a point of A1 and A2 milk, today is a world where everything, a new concept, gets extremely glamorized and goes to the market. And that's where market encases money. So A2 milk and A1 milk have got certain difference in protein. So when they are digested, A2 milk doesn't produce a chemical which A1 milk produces. Now that chemical, which is BCM, which is produced because of digestion of A1, that can lead to some issues with the gut, some indigestion, some diarrhea, some fullness, some bloating. So one thing is proven, A2 milk can be little better for the people who have got some kind of gastric upsets with A1 milk. Now there are so many claims which are made for A2 milk that it is good for diabetes, good for metabolic syndrome, good for insulin sensitivity, good for heart, good to reduce heart attack. They all are pretty wrong. And I personally, based on my data, believe they are not going to be right anytime. So it's just you can either consume routine milk, or if you believe that you are having some stomach issues and still you don't have lactose intolerance, you can take milk, you can go to A2, but otherwise there is nothing much. Third
Yeah.
point, which I would like to add, is adding milk to green tea, black tea, or coffee. That is also a very commonly asked question. When you add milk, does it reduce the benefits? The science at the moment believes that when you add milk, you are adding protein, you are adding carbs, you are adding fat, so you're putting calorie. So those people who are calorie conscious and want to restrict the calories because of various issues, they may not put milk, that's fine. But those people who rather want the calorie of milk, as is rightly said, protein and calcium, they can always put milk to their tea, coffee, or green tea. Addition of milk may reduce the speed of absorption of caffeine, so the effect may come little late and may last for longer time. And some theoretical issues have been raised that when you add milk, it may nullify certain antioxidants, but that is yet to be proven. So I believe, yes, you can add milk as per your choice, or you can go without milk.
Right. Before we move to next question, a very quick addition from my side. A2 milk is very much there in buffalo. In that case, I don't know why the A2 milk is created so much of hoopla. Probably, as you said, is capitalizing the ignorance of the people. And second, about the coffee. When we talk of coffee in a day, we forget about the coffee content of the chocolates as well as the cola and all these beverages where also there is a lot of caffeine. So maybe that we have to keep that also in mind.
Yes.
So next, we Dr. Dani.
There is another this grass-fed cows milk. So
Right.
the cow which is fed only grass, no other
Right.
vegetables, and they say that somehow produces better milk, and which is we reach again in those beta casein and whatever. It's all
Just like grass-fed hens were, and getting omelette is a non-vegetarian or vegetarian item. So next question is about the eggs, Dr. Samir. How many eggs we can take and where do place egg in the overall nutrition?
Okay, I personally place eggs high on nutrition especially if you are partial vegetarian like me, because protein sources are very limited as far as plant proteins are concerned for vegetarians. in our routine food. So soya is one of the important protein source if you like soya. And most of us in Gujarat, that especially 30 years back, 40 years back, when I was a kid, my parents had not even seen soya. So soya is a new addition to vegetarian protein. But barring that, the protein source is good, and that's why I like eggs as such. How many eggs are safe? By and large, most of the people will tell you that 6 to 8 eggs is very safe and very healthy per week. And if it depends on your physical activity, if you are really exercising well, and if you are otherwise controlling your diet well, you can have 2 or 3 eggs per day. That also is fine. One study has shown that eating more than 2 egg yellows per week, egg yellows I'm talking about, and once you start eating more than 2 egg yellows per week, it changes your lipid profile a little bit. So again, see, these studies are to be taken with pinch of salt, because it also depends on how much activity you are doing, how much other food you are eating, what kind of food you are eating. So I would say it all depends on your complete diet. You can't be saying that, okay, I can eat 10 eggs per day, so I must eat 10 eggs per day, and then it doesn't matter how much else I eat during the day. So by and large, I would say that eating 1 or 2 eggs per day is fine. Eating around 3-4 egg yellows per week is fine. Try to eat less egg yellows, but also egg yellows yolk has certain health benefits, which we all know.
But eating eating eggs and eating omelette is not the same, because that involves frying it. Yeah.
Absolutely.
So that
Absolutely.
Right. Right. Over to Dr. Dhiren for the other questions, please.
Yeah. So we discuss about what to eat. Now we go on to a slightly different aspect of the nutrition, and we will be talking about the vegan diet, about the intermittent fasting, about the keto diet, and the new concept low carb diet. So what is your take on that? Samir first, and then Anish. Yeah, Samir, please.
Okay. Very quickly, and then we can expand further. Very quickly, there are lots of new diets now. If you just Google them, or if you just check the net, or if you ask the experts, so many types of diets available, which are all touted to be healthy. And by and large, whenever you have many solutions for one problem, not a single solution is absolutely right. So overall, vegan diet, it has certain benefits, but you can't be religiously vegan all the time and say that that is the only way to become healthy. For a vegan diet to be healthy, you need to have right proportions of your protein, carbs, and fats. And once you get that right proportion of protein, carbs, fat, antioxidants, and other things, then it doesn't matter whether it is a vegan diet or non-veg diet or vegetarian diet. Second thing is intermittent fasting. Intermittent fasting is used primarily, or was used primarily, for control of the weight. And recently, one study has shown that intermittent fasting is not as good as it was believed to be for the heart health, especially. Even the keto diet, of course, which is a very famous thing and really very effective if you want to lose weight fast. Keto diet is a good thing, and it has a solid scientific basis. But tweaking your body's mechanisms and metabolisms in different way for short-term benefits is not going to work for a long-term health benefits.
Yeah, Anish, what is
intermittent fasting? Intermittent fasting to some extent, probably out of all these, is most appealing. But again, 16 hours and then concentrate only all your food in 8 hours is not really scientifically proven. 12 to 14 hours fasting is probably a better way to go. We need more studies on that.
Yeah, but 12 to 14 hours fasting is anyway, like say if you eat at 8 p.m. and then the next meal is at, you skip the breakfast and then automatically it becomes 14 hours. So
Correct.
that's not really a very difficult thing. But as you rightly said, that none of the thing is really sure for the heart. So Dr. Anish, what is your take on that?
Yeah, I mean, it's a very complex and good topic. And I think what Dr. Dani has said, I 100% agree. And let me put some other perspective to that also. So vegan diet, I personally believe, is more eco-friendly and more in interest of Mother Earth. So if more and more people logically, philosophically, and emotionally can accept this diet over a period of time, then it's going to do better with the Mother Earth. Having said this, I don't say that everybody has to get to vegan from day one only. Second point, which he rightly mentioned, that when you go vegan, there is a huge chance that you get deficiency in so many nutrients, particularly vitamins, minerals, certain elements like calcium. So that has to be planned very well. If on one fine day morning I decide to be vegan and I start eating only fruits, vegetables, nuts, and grains, and if I do not plan my diet very well, then there are chances that I may meet with certain deficiency of nutrients, and that can harm my health. So that my personal choice is, if you go vegan, it has to be extremely well planned. Proteins, calciums, vitamins, etc. Coming to intermittent fasting, that is RTE, restricted time eating. Now, see, that practice has been there, at least in India, for so many years in different forms. So intermittent fasting in broadly means you are eating for certain time period and then you are not eating for certain time period. Now, it can be rotating on a weekly basis. Say, for example, you make a fast of one full day and then you eat for 6 days. Or in Jainism, there is you eat for one day and then you don't eat for another day. And one which has become very famous in last 5 years is like you do not eat for 16 hours and you eat for 8 hours. Now, this intermittent fasting diet was introduced basically for two purposes. One is weight loss purpose for those who are obese, and second, to improve overall metabolic health and fitness for the people who do not have a goal for losing weight. So there are so many fit people who would pursue that. Now, how does it lead to weight loss? Was because you eat for only a given period of time, generally you cannot bombard yourself with high amount of calories. But let me be very clear, now data is so strong that for losing weight, what is most and only important point is creating a calorie deficit. If my caloric requirement is 1600 and if I want to lose weight, I have to consume 1400 calories a day. If I consume 1800 calories a day, even within intermittent fasting period of time, I am not going to lose weight. So the first and foremost principle is calorie is a calorie and you have to pay for, then you have to be responsible for. So intermittent fasting for weight loss should be done very consciously with a motivated mind that I want to reduce my caloric input. At the same time, one has to keep looking to himself, not only his body, but also mind and emotions. There are people who become extremely irritated, who become very anxious. They cannot concentrate on their work. They cannot have good relations with people. And they just keep shouting during the time of fasting. So it's very, very important that diet has an effect not only on body, not only physical parameters and biochemical parameters, but also in mind, emotions, and spirit. So a diet which doesn't suit your emotions, mind, and spirit, I'm pretty sure you are not going to take for a long time. Third point, which is low carb or ketogenic diet, is, as Dr. Dani said, it is one of the most dangerous diet I have ever seen in my career, because that diet has got so many issues and problems. So that diet, if at all is to be done for somebody who has got extreme obesity, who wants a sort of kickstart, it has to be done under a team of panelists where nutritionists, maybe a physicians are there and parameters are checked. The person has to be explained very well about what ketogenic diet means and what is the kind of parameter check which is needed. Coming to again still the most vitally important point which I always believe about diet is all this data, maybe intermittent fasting, maybe ketogenic diet, maybe vegan diet, most of them have most of the trials which have incorporated people between 50 to maybe 10,000, and all these studies have run for maybe 3 months to 5 years. So we are taking conclusions for lives of 700 crore people based on data which has been done on peanut size of people for a very short period of time. And as again I talk to you that market takes up everything so well for the commercial interest of so many vendors that the real truth is always hidden. I personally believe and talk to all of my patients, people, and friends that a diet has to be a diet where protein, carbs, fat, minerals, vitamins, and nutrients are in proportion. 50% of calories should come from carbs, better from complex carb, that is whole grains, 25 from fat, 25 from protein. You should create a diet which is quite adjustable as far as that principle of local, seasonal, and traditional is count. It should be from multiple diverse source, and you should be able to sustain that diet for rest of the life. You should be happy with that diet where not only your body performance is optimized, but where your mind and emotions are also well balanced and well optimized. So pick up that diet. And I personally believe that diet is the diet which has evolved in this continent, in this country. That's a very important balanced diet. All these new diet patterns can be adapted by some people who need it for the sake of improvement of their health, but for majority vast, it's all the time tested traditional balanced diet which matters a lot.
Thank you for having a balanced opinion about diet. And now we change the gears, and from diet we move on to the second aspect, that's exercise. And I hand over to Dr. Mahadev for that.
Yes, right. So we know Dr. Anish himself is a marathon runner and he has given so many lectures about the exercise. So we start with him. Dr. Anish, your exercise prescription for the good heart, and how much time of exercise, how many durations, whether it at gym or at home, and what kind of exercise, intermittent exercise, weekend exercise, or everyday exercise. So everything that you want to say in a very nutshell about exercise and heart.
Good. So exercise is a topic which I love a lot. And I personally believe that exercise regimen depends on who is doing that exercise and what are his or her goals. So an exercise regime for a patient, say for example, a cardiac patient or a kidney patient or a liver patient, has to be much different from an exercise regime for somebody who is just a routine person and seeking health. So I'm speaking for that person because the other issue is very complex and that's where we need personal attention. So for those people who want to seek health, exercise has to be a friend for entire life. So we have to again create a program which is for rest of the life. Number one. Number two, the time spent in exercise has to be ideally between 50 to 75 minutes on a daily basis. Now, those who cannot spare that much of time, even if they have 20 minutes, 10 minutes, it's pretty good because science is very sure that exercise improves your cardiovascular, metabolic, and mental health in dose dependent manner within physiological limit. So rather than not doing any exercise, even if I'm exercising for 5 or 10 minutes, that's going to count. Number three, which is very important, there are many people who are busy professionals or businessmen. They do not have a time at a stretch for 50, 60 minutes. Then what if I can do exercise 10 minutes, 3 or 4 times a day? It equally works well. So a person who does 50 minutes of exercise at a stretch versus somebody who does 10 minutes exercise 5 times a day, general cardiovascular health benefit are same. And that's why I keep on talking to all my friends, specifically doctors, and even I personally do. After every 1.5 hours in my chamber is shut for 5 minutes, for which I may be doing squatting, I may be doing lunges, I may be doing push-ups. So that's a very important way because it is well said that sitting is like smoking. So in many aspects, if you keep seated for long, long hours, you are doing wrong things to your body. In fact, data says that more the sitting time, more the mortality, less the longevity. So sitting itself is an independent predictor of your longevity of life. So if not exercise, then the least form of exercise is just stand up. So I tell to all people that after 30 minutes, 15 minutes, stand up, sit down, stand up, sit down, do it 2, 3 times. That's the simplest form of exercise, but it will puncture your sitting time. Maybe at 1 to 2 hours interval, you can walk around in your hospital, you can climb few stairs and come back. That is also increased physical activity. In fact, in 1953, a very beautiful article published by Dr. Morris in British Medical Journal was what happens to heart and heart attack of the conductors and drivers of London transport worker. 40,000 such people, drivers and conductors, were studied for 32 years, and what was found is risk of heart attack in drivers was 3 times more than conductors, purely because of the fact that conductors keep walking. Same data was replicated between telephone operators and postmen in those era. So keep active, remain physically active, keep doing something even during your professional day. Coming to again, if it is a structured exercise, then I personally believe number one, which we generally do and we stress, is cardio exercise. That's where your cardiorespiratory system is stressed. That's where we used to call them aerobic exercise. So walking, jogging, running, cycling, gardening, stair climbing, dancing, all they include what is called as aerobic exercise. So that generally has to be there for 30 to 40 minutes on a daily basis. Number two exercise is resistance training or strength training exercise. Previously, it was said to be anaerobic exercise, but now we strongly say that no exercise has to be anaerobic. The strength training exercise has got multiple benefits, not only for the bone and muscle health, but also for the metabolic and cardiovascular health. 20 to 40 minutes per session, 2 sessions per week, resistance training exercise has been said to be sort of compulsory by even American Heart Association. We have a myth that females do not need that exercise. That is unfortunate. Females need more than men. And we have a myth that senior people do not need resistance training. In fact, senior people need it more because as you age more than 45, because of various reasons, one of them is you lose testosterone, your protein intake is less, you do not do resistance training. A man keeps on losing 1% of his muscle on a yearly basis. So if you see a gentleman of 60 years, generally he has drooped shoulders, his posture, gait, balance, and equilibrium all is lost. So 2 sessions of resistance training very important, but mind well, one has to learn it with the help of a trainer and it has to be started in a very gentle way. Third point exercise is something for the core. Many people do cardio exercise, few people do resist training also or exercise, but people miss the core and core is very important again for balance, posture and equilibrium. So one has to do something for the core and that is if not at all those vigorous, aggressive, spine hurting exercise, simple exercise is either plank holding or supine leg raising. You just lie down, raise your one leg, raise your other leg, get them down in a controlled way. That will help to build up your core muscles. That is third form. Fourth form, which is very important, as we age, we become stiff, we have more chance of injury. So stretching is an extremely important part of exercise to be done on a daily basis. At least 5 to 10 minutes of upper body stretching, torso stretching and lower body stretching, that will increase a lot of vitality. That will increase your control on your body. And again, your balance and posture will improve a lot. And fifth exercise, which has less to do with the body, but more to do with the mind and emotion, is pranayama. Anulom Vilom and Brahmari are two pranayams which are mand pranayams to be done by everyone, irrespective of anybody, any age or disease. While Kapalbhati and Brastika are the two pranayams which are aggressive or Ugra pranayam to be done only by few people. But Anulom Vilom and Brahmari are very important pranayams to be integrated on a daily life. Now, this 5 form of exercise, when you keep doing on a regular basis, consistently for years, you remain invested in them for years and years, months and months, then you get benefit. But very important point is, before you start a strong exercise program, it is very important that you get a proper physical checkup. Because what we have seen is sometimes people are too enthusiastic. They start vigorous exercise, they get some serious injury to bone or muscle, or sometimes to their heart. So it's very, very important. Go to a doctor, check your blood pressure, pulse, routine basic parameters, certain tests in terms of blood test, and if need be, stress test, echocardiography, calcium score. So once you are very clear where do you stand today, start an exercise program. Again, mind well, if you are 40 years of age, you are doing it for next 40 years. If you are 60 years of age, you are doing for next 20, 30, 40 years. So plan a schedule slowly, keep it doing. I'm pretty sure exercise is one thing where if you keep invested for years, even the small amount, small time, it is going to give you a lot of fruits for the future.
Thank you. And you already covered the next question about the investigation to be done before exercise. But before that, to Dr. Dani, that people keep on repeating the 10,000 steps. So what about your take about the number of steps that at different ages, how much walking should be good enough for the heart health?
So Anish has covered almost everything as far as exercise is concerned. I would summarize it in one popularly known acronym that is called FIT principle, FITT. It is you decide frequency of your exercise, how often you should exercise, that is anywhere between 3 to 6 or 3 to 7 times a week. I stands for intensity, how hard to do the exercise, what kind of intensity, preferably moderate intensity exercise, depending on your age and your body type and your exercise capacity. But basically, you measure the intensity by measuring the heart rate. General principle of treadmill holds true here also. By and large, you push your heart rate up to 85% of your MHR, and generally try not to cross the MHR. How fast you go to your MHR or THR, how quickly you get back to your resting heart rate, that also is a guide to your exercise, guide to your fitness level, based upon which you decide your exercise. The third letter, that is T, is time. How long each workout lasts, as Anish said very clearly, that 50 to 75 minutes, but every minute counts. Every additional minute gives you additional benefit. So incremental time is okay. And if you have 5 minutes, exercise for 5 minutes. Very, very clear message from Anish. Absolutely true. And the fourth letter is another T, and that is type of exercise, which Anish talked about, aerobic exercise or resistance exercise or flexibility exercise, whichever. And there should be a balance of all these exercises together. And resistance exercises are not only important for your heart health, but for your kidney health also, as you very well know. How much steps, 10,000 steps have been so well highlighted recently. And because you have these step counters available for your mobile, I think it's a good way. Take it positively. How many steps you walk per day is a very important way to keep track of your exercise levels. And as Anish again said, it is not necessary to take 30 minutes or 50 minutes out of your schedule and just dedicatedly do exercise. It is very good if you can do that. But otherwise, you can interweave exercise within your schedule. And many years back, when the mobiles were new, I think, I'm not sure which company it was, but they had very beautiful ads. And that was walk while you talk and talk while you walk. So those ads were absolutely, they can be used for all types of heart prevention on a World Heart Day, So you can integrate these physical activities. As Anish said, you sit down, stand up, sit down. It will exercise your quadriceps so well. Your core muscles, all these things are very important. And try to take stairs every time you walk into a hospital or wherever you go, professionally or otherwise. So these things are very important. 10,000 step is not a kind of a level which everybody should aim at. As you grow older, 10,000 steps are not necessary. Once you develop heart disease, again 10,000 steps are not necessary. By and large, all the studies have shown that once you go to 6,000-7,000 steps, your heart benefits are generally as good as 10,000 steps. So 7,000 steps to 10,000 steps is a good range. And if you have a problem in doing that, again, as Anish said, 2,000 steps, 3,000 steps, 4,000 steps, every 100 steps that you add to your walking is going to give you more and more benefits. So it is not necessary that you have to get to 7,000 to get the benefit. If you don't reach 7,000 or 10,000, you don't get benefits.
Right. I fully agree. And in fact, I overemphasize the 10,000 part because people take it for granted that you have to walk. In fact, 10,000 steps, there was no study. There was no validation of 10,000 studies which was claimed. It was only one of the advertisement for a pedometer that they have made 10,000 feet steps as a advertisement, and that just became as if a slogan that you have to walk for 10,000, which is not required. Now, Anish, there are so many wearable devices are available in the market. So how reliable they are as far as the heart health is concerned? They claim that they can prevent heart attack or they can detect the heart attack. So which are good, and do they accurately measure the blood pressure or pulse or heart rate or steps? Your
A
experience.
good point. Again, see, as I rightly said, always when market enters, everything gets very glorified, very charismatic, and then they make you feel that if you use this, your heart attack risk is zero. So coming to a point, see, wearable devices are variety of devices are available. I personally believe, first of all, to have, if at all, some kind of accuracy, it has to be from a good house. Not just promoting the top brands, but if you go for top brands like Apple or Samsung or something such that sort, I'm sure they can be okay. The rest, all other brands, I'm not sure, but then there are chances of a lot of inaccuracies. Number one. Number two, if you ask those wearable devices to do simpler jobs, say, for example, if you want to track your heart rate as per the activity is concerned, if you want to track the number of steps you have walked, if you want to track how many floors you have climbed, so for all these simpler purposes, those wearable tracks are good. But as you ask them to do more complex jobs, say for example, wearable measures to ask them to use how much calories I'm burning, how much fat I'm losing, how much fluid I'm losing, then they become very, very inaccurate. And there are very few companies which are producing such devices. I personally would say there is no role of such devices. It's only heart rate, the steps count, the floors you climb, maybe even quantity of sleep at least. There are devices which you wear, they can give you idea about for how many hours you have slept, but they do not give you any idea about quality of sleep or NREM or REM sleep. So generally, I believe that you can use those variables for simpler purpose, number one. Number two, sometimes people do get panic because of all this. See, I have received on more occasions rather than right call, wrong calls that somebody believes that my variable shows, doctor, I have got a heart rate of 180, 190. Should I rush to you? Should I get ECG done? I first ask them a question that do you have any symptoms or any problem? They say, no, I'm fit and fine doing my routine activity. I generally say it is misread, misinterpreted because your arm is moving too fast or some such reasons, things have gone haywire. So I always talk to them whenever you get something on your wearables, then just be peaceful, ask yourself, am I having additional problem? And then sort it out. Otherwise, sometimes it leads to panic call. Third, coming to certain devices which can pick up really your heart rate and irregularity of heart rate. So that's where it has been used to pick up the episodes of atrial fibrillation in susceptible individuals. So yes, some such devices do pick up fast rates and irregularity of the rates, and then they can just probably say that you are having atrial fibrillations, and that's where a concept pill in pocket, that flecairide, can be used for people who have structurally normal heart. But I personally believe we should use those variables only for simpler purposes to track our heart rate and step count for long-term purpose, and we can just change our behavior based on the inputs of the devices.
Very true, very true. I think they have yet not come to the stage where we can rely fully, or they cannot be as good as even our pulse oximeter, which probably very fairly now have standardized that we can check the pulse rate based on pulse oximeter more than the variables probably. Second thing, that so many of our patients are on medications, whether it's hypertension medicines, diabetes medicines. So what is your advice about the medications and the time of exercise? Should we take before that, after that, or any precautions need to be taken?
Yeah, that's a very good point. And I personally believe, see, this was a very relevant question and more relevant before 10 years, but now we are having medicines which are working really long time. See, now antihypertensive medicines which work for 24 hours, the coronary artery disease medicines which work for 24 hours, even diabetes medicines which work for a long time. So I personally believe we doctors should keep on using those medicines which are working for long, long hours. And then after taking and consuming those medicines for a few days, the level of that medicine reaches a steady state level in the blood. So nowadays, most of the medicines are not that you consume a medicine, the level of that medicine goes up, the effect also goes up, and then after some time it comes down. So you take all the proper antihypertensive medicines, the aspirin, the other antiplatelets, the statins, all of them work for a pretty long time. So I personally believe the medicine time should be a time for a patient which remembers absolutely well without missing. That's the time of medicine. See, if I believe that night bedtime is something which I'll never miss a medicine, it has to be night time. If I believe morning after breakfast is some time which I'm never going to miss, let it be a time. Number one. Number two, whenever one goes for exercise, it's very important that neither it is full stomach nor it is empty stomach. One has to have something, maybe a cup of milk, maybe 2 biscuits, maybe some badam, pista, akroot, whatever. Some little caloric input before one starts exercise so that one doesn't get episode of hypoglycemia. Now, having said that, for more calorie burning, for more fat loss, fasted cardio is a very important way, which I personally do for so many years. But then one has to adapt to that, because you've taken your dinner at 8 p.m. When you start vigorous exercise between 7 to 9 a.m. and then you take some caloric input, there are many people who will go hypoglycemic. So take something before you start exercise and then follow the warning sign principles of exercise. So when you get some unusual chest pain, unusual disproportionate perspiration, more breathlessness, some jaw pain, lightheadedness, heavy-headedness, or you believe today the day is different, I'm not happy, or some viral illnesses, then please don't do exercise or do only pranayams or just gentle walking. So medicines which work for 24 hours, taking some little caloric input before you start exercise, understanding the warning signs and understanding your body signals and carving your exercise program for that day based on your body signals, I'm very sure you'll be safe.
Right. For cardiac medicine, I agree. But I think for anti-diabetic medicines, it is better that he discusses with his physician before taking up the exercise, because there are chances, as you said, of hypoglycemia. That's very important. And Dr. Samir, people are having an impression that if they have sorbitate in their pocket, or if they keep taking sorbitate, they'll be not having heart attack anytime. So how often would you say that the sorbitate should be consumed? And is there a role of sorbitate in these days? I'm using the trade name, but because nitrites, maybe that we can say.
So sorbitate has not been found to be useful in heart attacks. That is for sure, because heart attack is caused by kind of 100% blockage in the artery, and that blockage is not going to be opened by sorbitate. Usually that blockage is thrombotic in nature. So the medicines which are useful in these kind of heart attacks is they are antiplatelets like aspirin, clopidogrel, or ticagrelor, or prasugrel, etc. And taking dual antiplatelet in right doses is the way if you feel that this person is having heart attack. So sorbitate is not going to be useful for heart attacks, but sorbitate can be useful for angina. Now, when you feel that you are having a chest pain and that chest pain is easily resolved by taking a sorbitate, you can theoretically consume sorbitate. But many studies have shown certain harmful effects of sorbitate even in such scenarios, because many times you are walking, exerting yourself, and sorbitate produces sudden hypotension and you can faint. Many times sorbitate is consumed too rapidly. The standard recommendation is that you take 5 milligrams sorbitate sublingually while sitting or lying down, definitely not standing. You keep a 10 minutes break in between. If it doesn't work, you can try one more sorbitate after 10 minutes, and then in 20 minutes, if it doesn't reduce your chest pain, you rush to a nearby hospital. So if you are accustomed to taking sorbitate for your angina, you can continue to do so with certain caveats, but it is better that if you need to consume sorbitates regularly, it is better to readjust your anti-anginal medications or even seek an intervention from your doctor.
So do you suggest that keeping a statin or a clopidogrel aspirin is better than the sorbitate?
Absolutely. Keeping aspirin, 350 milligram of aspirin soluble, keeping either 600 milligram of clopidogrel or 180 milligram of ticagrelor, and keeping 80 milligram of atorvastatin or 40 milligram of rosuvastatin in your kit. Make a kit like that, and that is more useful for emergencies rather than sorbitate.
Right. Over to Dr. Dhiren.
I mean, just putting one point,
please.
Dr. Mahadev, what Dr. Dani said is extremely important. Just a practical hint out. Number one, if somebody takes sorbitate, it's better he sits down or lies down and take it. and doesn't take another drug before 5-7 minutes. And once he has chewed it, if he feels better or not, he has to take a glass of water or liquid if available, so that hypotension doesn't happen. Generally, what I talk to people, somebody who is not a non-case of coronary artery disease, if he or she gets for the first time chest pain, Disprin, statin, and clopidogrel, they are the best thing. Somebody who has been a non-case of stable coronary artery disease, who has been on already aspirin, statin, good drugs, good anti-anginal, if he starts developing effort angina, for him, sorbitate, a careful use can be okay.
The idea
Okay.
is that sorbitate probably has killed more people than saved more people. That message should go loud and clear at most of the such platforms. So that was the idea. Right. Over to Dr. Dhiren for the rest of the questions.
Yeah.
We're almost, 1 hour.
So the next question, which I would like to ask Dr. Samir, let's say there is a 50-year-old executive having a sedentary lifestyle, and he has a blood pressure. Now you suggest that you need to start exercise. So do you recommend any cardiac investigation before suggesting exercise, like what Dr. Anish said, 20 to 30 minutes of walking or strengthening exercise? So do you recommend any cardiac evaluation before the test, before the exercise, starting the exercise?
Absolutely, absolutely. Anybody over age 40 is embarking on exercise program, or anybody who's not used to exercise is starting an exercise program, should undergo, especially above age 40, should undergo some form of cardiac test, health checkup. And for a 50-year-old executive, like you mentioned, I think it is very important that he undergoes regular health checkup with a physician for his cardiac status before embarking upon the exercise program. That now what this health checkup should include, that is, I think, a prerogative of that particular physician based on detailed history and clinical examination. He may or may not choose to do a treadmill, and what kind of exercise program he is embarking upon, depending on that, he can decide. But some form of evaluation by a qualified physician is absolutely essential before you start any type of exercise program, especially when you have not been exercising for a while.
Okay, good. So that's a very important thing, that yes, exercise has definitely a beneficial effect. But if you are not accustomed, you have not done exercise for last 10, 20 years, then it's better to have a proper evaluation first and then start exercise. Yeah, so that's very, very important point. The second point, which is really controversial, because for so many years we used to say that some or little amount of alcohol is good. And recently the study, the recommendation by the World Health Organization clearly says that not a single drop of alcohol is good for health. Any system, not heart, for any system, it's not good. So what do you think?
I think we have come a long way as far as alcohol is concerned in the research related to alcohol and health. And most of the recent reports which have focused on negative health effects of alcohol have focused on this particular phenomenon. And as is true for exercise, as is true for food, as is true for anything, the effect is most often more linear than we thought before. So as you consume more and more alcohol, the health effects become more and more negative. And previously, what we used to think that 1 drink of alcohol per day and 6 to 7 drinks of alcohol per week is fine and is moderately beneficial, that is not true anymore. What we have found is that if any type of alcohol, any amount of alcohol damages your liver, brain, and heart. And alcohol has, apart from other effects, alcohol has direct toxic effects as well. Now, the point which we used to make many years back, that moderate amount of alcohol probably doesn't harm the health as much, still holds true. It is just we just need to understand the same facts with a different understanding. If you are drinking one drink of alcohol per day, it is not as harmful as 2 drinks a day, which doesn't mean that you ask somebody who is not drinking alcohol to start having a drink per day. Somebody who is having 2 drinks per day, you can gently coerce him into either quitting alcohol or going down to 1 drink per day. And 1 drink is strictly 30 ml. And now most of the people who drink alcohol, they argue when I say this to them, that what is the use of 30 ml? You know, that doesn't satisfy me at all in any way. And then the next counter from me would be, then why not quit? So I personally think that it is the same facts which we have understood better now, that red wine paradox, or French paradox, we used to call, that the French people drink a lot of red wine, a lot of cheese, a lot of meat, and still they live longer. It has nothing to do with wine, cheese, and meat. It has a lot to do with their genetics, their environment, the way they eat. The way French eat their food is extremely different from how we eat. The way they fry or shallow fry, or the way they use oil is very different from the way we use oil. So there are so many differences. Their lifestyle, their activities, it's very different. And we are almost getting there. See, and everywhere in the world, people are getting to live longer. There is a population which is going up to 80, 85, 90, and remaining healthy everywhere. There are places like in Japan where people live much longer, and still in Japan, people who live 100, that island, I forget its name, where there is a highest number of people. Okinawa, where there's a highest number of people living more than 100 years is there. It is not that they don't drink alcohol at all, but there are so many other things that they do. That 80-20 principle is something which we did not talk about. The Okinawa principle, where they say that you eat only 80% of what your appetite is. You always keep 20% of it. So quantity of food is something which is very underrated by most of us. So same thing goes for alcohol. I would say that alcohol's benefits are absolutely overrated. And we know for sure that any amount of alcohol damages. If you want to enjoy very responsibly, and you know that every ounce of alcohol that you consume, that you enjoy, is going to be detrimental to your health.
Yeah. So the next question.
Dhiren bhai, let me put one point to this perspective, because in last 5 years, a lot of articles, lot of data came that, as Dr. Dani said, alcohol in dose-dependent manner, starting from first ounce, increases linearly cancer risk, particularly CA breast, CA esophagus, CA colon. And they said it so well that when you drink alcohol, even 1 drop, start thinking that I am getting my cancer nearer to me. And those people who have got family history of CA breast or CA esophagus or CA colon, they should never drink. So suddenly attention, which was from liver, heart, came to intestine, esophagus, and cancer. And that's where all the societies are now very clear that not to having even a single drop of alcohol is best status. And as Dr. Dani said, somebody who cannot refrain, then maybe 1 drink with healthy biting in a very gentle, moderate way. But that is something which is too difficult for most of the people. So to be teetotaler is the best status.
Okay,
and
so now
apart from cancer, Anish, another risk is now very well established is dementia.
Yeah, dementia.
So now in the remaining time, we would like to focus on the last point of the healthy lifestyle, and that's the stress. Recently, a video which is we see very frequently, the friends, they go on sending that video. Once they came to know about this webinar, they went on sending that video about the stress. So I would like to understand, Anish, from you, that what is the effect of stress? And the young people, less than 40, they are getting heart attack. Is there a stress a major factor in them?
Yeah, say it's a very important point. And before I go into scientific data, let me tell that stress is basically quite individual and very subjective. Stress is the way I take the situation. So for me, something which can be a stress, for somebody else, it can be a pleasant thing also. And I keep on giving example that somebody tells me that, Anish, you have to drive to Rajkot by yourself, then I may feel it is little stressful. But then if I talk to my son, who is 23 years, would say, Papa, let's have a cup of coffee, and I'm ready anytime to drive to Rajkot. It's a pleasant journey. So it's very individual, very subjective. So something which is a stress to me may not be a stress to somebody else. Number one. Number two, life is not possible without some kind of stress. There will be always some kind of stress. Say, for example, if all of us four would not have kept some stress with us, we could not have done this seminar and session. All of us had to think maybe before 2 3 days, maybe since today morning, to adjust life, to squeeze our schedule and come here. The issue is how we can well manage and adapt to stress. And if at all, I can increase my ability to take more stress without affecting my health so that I can progress and perform better. So that is a real question and issue. So for that, there are so many things. So one thing is very sure: when stress is beyond what you can handle, what you can manage, when you perceive that you are dragged by life and events rather than you are driving your life, that's a kind of state where your stress is getting over yourself. That's where your resting pulse goes high. That's where your blood pressure goes high. That's where risk of heart attack and stroke increase. That's where abnormal diet pattern emergency. That's where abnormal sleep pattern emerges. That's where you start getting addicted to tobacco. So yes, when stress goes beyond certain limit which you can handle, you will end up with a lot of problems. The best way is to manage and cope up with stress, and there are very established ways to do that. And one of them is training your mind and your emotions. Coming to a point that many youngsters are getting heart attack in today's world, that's very right. And what we have been witnessing for last 10 years is there has been a steep rise in the risk of youngsters getting heart attack. Now we all have known that exercise, food, etc., they are important points. But two, three, four things which have gone extremely wrong in the youth and which has been going very wrong for last 10 years are number one to me, and which is most important, is substance abuse. Tobacco, alcohol, cannabis, and weed. Extreme high level of substance abuse is prevailing in today's youth. That is something which is very important. Two, a lifestyle which is against the biological clock, circadian rhythm, or mother nature. Most of the youth today, because of various reasons, they have to study, they have to do some job, they are working for the Western worlds, so they have to remain awake till late night, maybe 3 a.m., 2 a.m. They sleep at 3 a.m., they sleep maybe up to 12 midday next day. They believe we are taking adequate rest, but that rest doesn't work for the body and health. So that is impaired quality, quantity, pattern, and timing of sleep. That is, I believe, second problem. Third is, as you rightly said, stress because of various reasons. Sometimes stress is because of right reasons. Say, for example, they want to succeed in exam, they want to crack entrance test, they want to do some better business and growth. But sometimes stress is for wrong reasons. Say, for example, because of emotional instability and emotional reactivity for so many things which generally should not cause stress is causing stress to so many youngsters in today's world. Say, for example, a friend who has been there for last 1 year, now for 1 or 2 days, that friend has not made a phone call or has not made a WhatsApp message, this person starts getting stressed. So we need to understand that sources of stress are right and real, and they are also wrong and irrealistic. So that's where we have to work. I personally believe unless we train our mind, unless we learn to understand our emotions and regulate them well, we are not able to get out of this stress cycle. And there are ways. I think there may be questions on that, but then being with the nature, doing regular exercise, making your sleep cycle well, having good relationship with the people and friends surrounding, reading good things, going to some satsang or some good seminars, music, good hobbies, gardening, meditation, all these things I'm pretty sure are going to help anybody who is feeling more stress.
Okay, thank you. So, like we are just coming to the end. Samir, would you like to add anything on the stress part, on the meditation or yoga?
No, I think I agree with everything that Anish said. Habits, hobbies, relationships, your lifestyle overall is very important in developing an ability to cope up with stress. I would just add one more point, and that is what we have discussed in the earlier part of this session, and that is exercise. Exercise adds to your ability to handle stress, and it is one of the easiest ways to handle stress. It has been proven now in various studies that, like meditation, like yoga, like developing your mental abilities, like habits, hobbies, relationships, sleep, everything else, exercise plays an equally important part in developing your ability to cope with stress. So, like that old saying that says that sound mind in sound body with sound mind is equally true. Sound body develops sound mind. So, I would say that the benefits of exercise kind of doubles because it helps you cope with stress.
So it has a direct effect on the heart and then indirect effect via brain also.
Hormones, yes.
Hormones, right? Yeah.
Happy
So
hormones.
with that, yeah. So with that, thank you very much, both of you, Dr. Samir and Dr. Anish, for joining with us and sharing your vast experience with our audience. And I request our audience that please share your feedback on the WhatsApp message. Please note down the number. It's 97129 25600. I repeat, 97129 25600. So with that, I thank Mahadev Bhai, Dr. Samir, Dr. Anish, and OrthoTV for making this possible. Thank you and have a great day ahead.
Yeah, thank you. Thank you, everyone.
Thank you.
Bye-bye.
Bye.
Yeah, recording has stopped, so now we can chat. Good.
Good. Yeah, thank you. Maybe somewhere we were a little lengthy, so you had to rush somewhere.
Yeah,
but
so
that's
like
fine.
say we managed that, so
Yeah.
that's okay. But I think that we really gave a very clear message. At least message was clear.
Mahadev bhai, you need to unmute yourself.